welcome to the interview segment of Let's Talk Health today. And today we're talking healthcare technology and how it can impact the Nigerian healthcare space. And we have with us in the house Obodozie Christian. He's a pharmacist and a healthcare technology entrepreneur. Thank you for joining us on the program today.
Thank you so much.
All right, first of all, when we say healthcare technology, what exactly do we mean for the sake of those that it might sound ambiguous in their ears?
Well, healthcare technology basically is those systems, those applications that ensures and helps tracking and systematic use of information, patient information by patients and professionals. You understand?
Okay.
Within the healthcare system, actually.
Okay.
Yeah.
Can we have instances?
Wow, there are lots of instances.
Okay.
I think I would start basically, in a hospital. The normal thing we have usually is that you go to the hospital, you have your card, you have your files, your information, basic science and all the rest is written there, and the entire diagnosis is written and then it's stored somewhere. That's what we used to do before. But now, with the advent of technology now, you now know that, all information can be stored in one particular unit. You understand?
You don't have to be carrying papers
around. Yes,
around.
You don't have to be carrying papers around and all the rest. You can access, you can, from wherever you are, you understand? It ensures good tracking, good records, and reduces the risk of wrong diagnosis over time. That's just one area also. Yeah. Like I said, it's a multi-dimensional circuit, actually. But in a nutshell, this is what we're talking about.
Okay. Now, looking at Nigeria, because definitely we can't see anything without bringing it back home and, taking a look at the healthcare space in Nigeria. We know that a number of factors have hampered the growth of Nigeria's healthcare system, from inadequate facilities and infrastructure to storage of personal information to, inadequate training and high illiteracy among the people, electricity and all of that. Now, in some parts of the world, reports say that telemedicine has really, basically technology has really helped improve healthcare in some other parts of the world. Now, in Nigeria, how would you, say we can use telemedicine technology basically to improve our healthcare system?
Well, we actually can do that. It's viable. It's very, like you said, it's very functional in other parts of the world, in advanced countries of the world, actually.
Yeah.
And quite a little segment of the society, of the healthcare population here, are actually trying to use it and adapt it, actually. But the econometrics, economy of the country, exposure, and the technology density means that it has not really driven in so much. But however, it can actually be used. It's very important, very crucial. Imagine you need a consultant, say an optometrician, or say, gynecologists are all, specialized area. And you are somewhere, say in Sokoto, and you actually don't have that. And there's someone in Lagos that can actually really give you exactly what you want. You need to run down to Lagos, meet the person, and all the rest. So, as it is now, on a scala, on a little quantity, people are actually acceding to that and using it. But like I say, it's for now, for our country, is an elitist thing. Even the middle class rarely do access. I not talk of the lower class, the rural areas. Yes, and you quite agree with me. Well, statistically, the bulk of our population is in the rural areas. So whatever we actually do, whatever we do on health, on IT, and all the rest, we should always have a little. A major focus of ensuring easy access to a vast population of people. Yes, and so I'm a healthcare entrepreneur, and there are a lot of health IT entrepreneurs out there. You talked about telemedicine. If there is a way we can actually do this to come down to the middle class, let's concentrate on the middle class for now, because I can't even say the rural people, actually. The middle class, You understand? Much more being available, accessible. The what do you call them, MTN and all the rest, the telecom companies and all the rest should also be part of this. If it's not rocket science. It's just an app. I mean, you do what they call it, emo. You do WhatsApp video calls and all the rest. So it's not. You see, if you say telemedicine, people think it's something ambiguous, something out of the blues. It's just like you do your normal WhatsApp call. Imagine you're having a WhatsApp call with a cardiologist. Just that's essentially beginning of telemedicine. That part of telemedicine. Oh, doctor, I mean, it's this way, I'm feeling this way, this is happening. He's hearing you, he's clocking you live and direct.
Yes.
You know, so we can
you
actually
don't even have to travel to go meet him.
We can actually do it, you know, but it's just the concept and conceptualization of it. People think it's something out of the ordinary. You do WhatsApp calls, you do Facebook calls. So why can't you have a video call with your doctor? Then if you say that, it becomes a big thing. There's nothing in it.
What do we attribute to this? Can we say is our attitude to healthcare generally in Nigeria? Because, you know, studies have shown that as a populace, we don't really take our health seriously like the way it is in other climes. Can we attribute it to our attitude to healthcare generally in Nigeria? We can attribute it to that, and then yes, basically that. Our attitude to healthcare. There was a time we were having something to do on emergency ambulatory healthcare some time ago. And I asked someone, Madam, imagine we tell you to pay 10,000 naira for care throughout the year. You understand, your entire family. Anything that happens to you, just call us. I mean, you have paramedics, this, that. The woman said, okay, look, our life is in the hand of God. Don't worry. You understand? That's the classical way we see things here. And when it happens, say, oh, that's so God wants it. That's how God wants it. You understand? You don't plan ahead. You don't. You can. If you tell, okay, we're talking telemedicine now. You tell someone, okay, would you prefer to download and have a WhatsApp video, WhatsApp on your phone, or have let's say PTP, whatever you call the app for telemedicine, P telemedicine. And you say, Aveta, he wants to do Facebook. Facebook is very important. But then you can have an emergency. You could want to talk to a doctor. You could need your life is at stake. But then you I mean, at the spot, what you want is something you used to chat, laugh, post, and like ladies who call it slay queens and all the rest. Yes, you slay queen, and then you don't care and think about it. Yes, the attitude, like you said, is our attitude to healthcare is poor, is terrible, and I believe it comes from, that's to do with where we are coming from. Actually, we have this enormous belief in God. We all believe in God, but you can't think that God, if you don't exercise yourself daily by prayers, God is going to make sure that your cardiac muscles are going to be very fine. That even the Bible says faith without work is dead. You have to, I mean, help yourself. I mean, and before other people help you. Then aside that, there's also the issue of lack of will from the authorities. First, authorities. Secondly, we the people in private sector who are supposed to be pushing this. You understand? It's information. If the commissioners of health, ministry of people in the healthcare, you understand, stakeholders, ensure that, I mean, people get to understand that, look, technology is here for you, not just to chat and browse and all the rest, but also for your health. For your health, you understand? There are a lot of apps out there that you can download that tells you if you have cough, if you have headache, if you have various signs you have. I mean, through apps you can know, oh, actually this is actually what it is. There are lots of apps for that.
Yeah, really? There of course there are apps you can download that. But who knows that? We don't even care to know.
So who does it fall on now to pass this information to the populace that see you? This is available. It's
information. It's orientation. I say, well, for me,
I think this orientation.
I think for me, I might not be right, but I think it falls under the purview of the Ministry of Health.
Okay.
Do you understand? To ensure that, to educate. Recently, I saw, kudos to them actually. Yesterday, I saw a circulation from the Ministry of Health talking about some hospitals in Egypt that harvest kidneys and all the rest, and they actually wrote that memo, sent to NMA to circulate to all hospitals. for people that go for medical tourism, please beware of so and so hospital, because those hospitals, I think the MDs are being prosecuted in Egypt.
Oh,
They're on
okay.
trial.
Okay.
You understand? So it's
That's some
on
useful
record.
information.
Yeah, that people that go to those, it's been the authorities in Egypt has found out that they do harvest. I mean, you could be put on a nation. You understand? Anesthesia, sorry. You are sleeping and then you're knocked off and operations are going on. Then one of your kidneys is taken off and put somewhere.
Wow.
You're not conscious.
Without your knowledge.
And after, or you could actually have a different, maybe something else that is being worked on you. The surgery could be for something else. Your kidney is taken off, you understand? And the entire main thing surgery you came for is done and finished.
Yeah.
And then you're switched up.
Wow.
How would you know? Do you know the amount of kidneys you
Of
have?
course
You don't know. You wake up and like, oh, thank you, doctor, I'm very fine.
Wow.
And you're coming back to Nigeria with just one kidney.
Yeah.
And they said, so it's a business, it's a trial, they do it. So I really give thumbs up to the Federal Minister of Health for that information, for sharing it and informing the people. So that's what I mean by, there should be a department there that really layers it, talks to the masses, ensures, tracks our use of certain facilities abroad and here, tracks our use of our use of apps, healthcare apps, do you understand, that are useful to us.
Okay. Now let's talk about accepting this, embracing it. Let's look at the limiting factors. What are those factors that have limited us, in making us not to accept telemedicine, not to accept technology in healthcare in Nigeria? What are those factors that have hindered us? You've mentioned, I know you've mentioned political will. The political will has not been there, for concerning health matters. So what are those other things? What are those other limitations? For example, now, if you mentioned some apps, there are apps that you can use to know some certain things in your body is wrong. Now you can also look at our internet providers. How strong is the internet? Even though if someone wants to get some of these things, how receptive is our internet network in Nigeria here?
I think one of the core factors is cost.
Okay.
The economy.
Okay.
Do you understand? Someone tells you to get let's say 20 gig per month. I don't know how these telcos advertise it. 20 gig per month at so and so price. And if you want to do such video call, such thing on telemedicine, you don't rush. You have to call, talk, call again. How many people would afford to?
Enough data.
Yeah, and some of these apps, at times you could pay monthly, per annum. You understand? Most are not even from Nigeria. One is from Israel. I know another one from two from states and others. Now paying for the apps, access to the app, and then ensuring you keep having the data. Do you understand? For that, and then access also to these professionals. Do you understand? You also have to be referred or have access to, say, a consultant instead of going to, say, India, for example, like I would normally do.
Yeah.
How would a young man even we say to here know the best, the professional, the person he needs abroad? You understand? You have to go to, say, I don't want to call hospitals, but the elitist hospitals in town. You understand? You know the cost, their cost. You understand? And it's expensive. You understand? So cost is one very big factor. And secondly, absolute ignorance. Would I say intentional ignorance? Because people, it's not like people don't know that your health is important. But you know your health is important, but you actually choose some other things.
And then wait for the dying minutes.
And wait for the dying minute to then rush and then, start flying abroad and all this. Why you can actually... Another very key important thing is we keep talking about medical tourism.
Yeah, so I was going to come to that.
Okay. Yeah. So it's we are a lot of my friends. I have Dr. Douglas. He's a consultant neurosurgeon.
Okay.
He trained in the UK. He's now back here and working. This whole thing about reverse tourism, medical tourism. Actually, we now have a term, reverse medical tourism. You understand? To ensure that, look, a lot of medical procedures can be done here, but because people do not even know. If I ask you now,
well, is it that people do not really know, or that there's this thing about Nigerian mentality? If it's not done outside, it's not the best. because I believe that the elites who go outside, I believe most of them, they have knowledge of big good hospitals here in Nigeria where these things can be done. But I think just because they have the funds, you know, they just want to go outside and do it.
Oh well, it's a combination of the two.
Okay.
People seem to want it. I mean, the best is outside.
Yes.
Whatever is outside, even in products.
Mm-hmm.
I mean, there's
it has to do with our mentality.
Yeah, there's some young entrepreneurs there. Even I mean, that design has in Lagos that does very wonderful, nice set of quality shoes. But tell someone to buy that shoe, they tell you no, he wants one from my product. That's one actually. But then also you cannot rule out the fact that people do not know. If I ask you where you do certain procedures, say spinal surgery here in Abuja, I assume you don't know that.
I would know, but some other people would know.
Good.
Yeah.
Well, because you are in this, but a whole lot of people would not know. There was a woman in NYC here. She was posted at the NYC coordinator in Borno then, and she had this serious eye problem. And the doctor told her, look, you have to go and see a surgeon, an eye surgeon. Yes. So where do I get that? And it was getting worse and worse by the day. She didn't know how to. Where? Do you understand? That's the issue. She's educated. It's not just education. You understand?
Who does it fall on now? The doctor who told her you're supposed to go see an eye surgeon. I mean, he should have an information for where she should go. Who does it fall on now to give this information?
It falls on us.
Okay.
Now I come to the private sector. It falls on us, the health tech, people in the health tech industry, to ensure we develop. Yes, it's even available. It's almost available now. We're developing that. A compendium where you can say you need, say, a cardiologist, and it appears the nearest cardiologist around you. You go there. Do you understand? That's actually what we're discussing that with the woman. She said she actually was by luck. She saw someone in church. I said, okay, I know Susan Super. So if she didn't have that luck, probably she would have a bad eyesight. So we should be very proactive in developing these products. Do you understand? As much as the market trends, we might start thinking about how much traction are we going to have. You understand? Because if you develop a product, a software, and nobody uses it, I mean, you've just...
That's a problem.
Yes. However, we should be proactive in developing these softwares. You understand that? And not just developing it, but the healthcare industry also accepting it for use. You understand? The doctors, everybody in the healthcare sector. You understand? It's actually very key. It's very important. I just wanted to say that information technology in the healthcare sector is it's like a fuel to a moving car. Do you understand? It's very necessary, very important. You understand? If you look back in the days, I grew up in Lagos. We had a hospital in Lagos. I was always seeing patients not rest from childhood. You understand? And I know how things are done then. Way back then, they used to boil syringes. Obviously, that wasn't happening. Yes, but it did happen in this country.
I'm trying to imagine that.
Oh, well, I'm older than you, so I know that. The needle, after using, you bring the syringe, you boil it, autoclave it, and boil.
Wow.
Yes, for you to for the next person.
We've advanced.
We've advanced. So also in the bringing IT into healthcare, we are meant to be moving with the trends, and we're very slow in catching up and moving with these trends because it's really useful.
You see us catching up anytime soon?
Well,
is there a hope?
Of course, yes. Of course, yes. There is attitudinal change.
Okay.
And this attitudinal change is not, I tell you, it's not, one should not beg for it to be accepted. It is for our own good. It's for our life. It's for our own safety. You understand? A lot of things, both the one on the immediate and on the long term. Let's go to antibiotics, for example. Drug abuse and drug misuse are two different terms. You understand? If you misuse a particular drug, over time, you start, say antibiotics, for example, you start having resistance trend. Do you understand? Of a particular microorganism to a particular. In short, a lot of antibiotics now are having, there are resistances to antibiotics. You understand? How does this come about? The normal thing people tell people on drugs here is, okay, madam, take it 3 times daily. But I keep telling people, I went for a conference the other time, and I was like, look, this 3 times daily thing is one of the most erroneous prescription order I have seen, and it keeps harming people, and we don't know about it. Three times daily actually means 8 hourly.
Okay.
12 times daily means 2 times daily means 12 hourly. And if you're supposed to take a drug 8 hourly, and you say, okay, I'll take it 3 times daily, someone can wake up at 7 o'clock in the morning, he takes one.
Without checking the proper time.
Yes, 7 in the morning, he takes one. Then once it's 12, it's afternoon, he takes another one. That's how many hours? 5 hours.
Yeah. It's
and
not
then
8 hours.
In the evening, say 4 o'clock, he takes another one. You see, the posology, the distribution of drug in the body, doesn't really match with what is expected to work on the microorganism, causative microorganism. You understand? So we over time, you see, this microorganism starts using the drug as a substrate, that as food actually. Instead of it being a drug, now it starts. The more you give them, the more they grow. So, and 2 times daily is 12 hours. If you take your drugs per hour, like every 12 hours you take the antibiotic, then you expect real work. Yes. So our apps also comes in that aspect. There are reminders. There are apps that once you're given, say, let's use Ampiclos for example, you just key it in. Do you understand? Every 6 hours, in interval, it tells you, it beeps, tells you how to, that, okay, you have to take your drug. You understand? Because most time people forget, actually. It's forgetfulness that causes this. You understand? So once it's time for your drug, it beeps and reminds you. It's called reminders. And people could see it as not, it does not, but it's very important. It's very key. It's very necessary you take your drugs as at when due. So there are lots of apps. This is just for this. In every area of the healthcare sector, there are three functional. You say big area in health: diagnosis, those in the lab.
Okay.
Not diagnosis. Sorry, analysis. Okay. Those in the lab. Okay. You understand? Diagnosis and prescription. Okay. The doctor. Dispensing. The pharmacist. That's the drug. You understand? There are the nurses. Everybody. It's a multifaceted actually. But these 3 core areas can benefit tremendously from the IT industry, health IT. Do you understand? Okay. There are various ways now. Well, these are all abroad actually, but in the country we've not started. Per analysis, there are more advanced ways of doing medical analysis, and you yourself as a patient, you understand, can have on the spot information on whatever chemistry, whatever thing that has been done to you. Not, okay, Oga, you have to come tomorrow, or Oga, we have to send it to you. You understand? Yeah. For the doctor, there are apps, there are tools that enhance diagnosis and reduces medical error to a very high percentage. Okay. For the pharmacist, there are the tools that ensure that patients get the particular drug, like I talked about, reminders, do you understand? At the right time. So at all points in time, the entire healthcare system needs crucially very, very much these apps to function. IT in healthcare helps you to have this. You are the doctor in Lokoja, sees you. Oh, tell me, how are you? Okay, what's your medical data, or what do you use, or whatever name is called. You give the idea and whatever, and he goes in and types it, and all information comes out. Oh, really? You last year this happened. Okay, this is all right. It's okay. So what's wrong? It's okay that he says he has the background information. Now, so what's the problem? You're talking and he's relating with the background information. You understand? So we are still treating ourselves. We're still working basically here, not in line. We're not working in line with the way it's done. Yes, over there. And we need to, it's not rocket science like I keep saying. It's something very easy.
Thank you very much for coming on the show. The program is still Let's Talk Health, and we've been talking to Obodozie Christian, and he is a healthcare technology entrepreneur. Well, you've had so much, you've learned so much on this interview. We'll go on a very quick break now, and